54-year-old Jean Van Adder, a former smoker and metal factory worker from Barboursville, is taking part in a low-dose CT lung screening at St. Mary's Medical Center.
So a lung CT screening is a CT scan that uses low-dose radiation for patients to come in to see if there's any kind of early stages of lung cancer or lung nodules that we might be concerned about.
So why is it important for someone like Jean to schedule a low-dose CT lung screening? And what does that screening involve?
Main benefits would be that if you are at high risk for lung cancer and we would find something that's in the early stages, that we will be able to treat it. Because lung cancer in the later stages, there's really not any kind of curative treatment, it's more of a palliative treatment. The CT is very simple, just takes maybe 5 minutes at the most. There's no needles, no pain or anything. The patient comes in, lays on the table. They might have them take a couple deep breaths as they go in and out of the CT scanner, but other than that, it's very simple.
If you qualify for a low-dose CT lung screening, St. Mary's has made it very affordable for you to get one.
We have kind of two different options you can do. We have self-pay, where the patient comes in and pays $75, and that includes the reading of the CT scan as well as the scan itself. Those patients have to be between the ages of 50 and 74. You have to be at high risk for lung cancer, so you have to have either a smoking history or be a current smoker or have some pulmonary diseases such as COPD, pulmonary hypertension, or also be exposed to hazardous things. So like in the workplace, if they're exposed to chemicals, metals, asbestos, and things like those would qualify you. Now, if you are wanting to do the insurance-based, those are a little bit different, and each insurance has a different set of qualifications. Most of the time, they're around the same ages, 55 to 77. You have to for sure be a past smoker or a current smoker to even qualify for the insurance-based ones, and then the hazards as well as from the workplace or what they've been exposed to in life. If you're not eligible for the insurance ones, because most of the insurances will cover it, but the $75, because it's a couple $1,000 test, so for $75 to be able to get this scan done and read by the radiologist is a very good deal.
And Jean Van Adder would echo that statement. His CT scan showed no presence of lung cancer at all.
That's a great deal. I mean, that takes a load off your mind. To know that you don't have cancer, that's worth $75 to anybody.
Low-dose CT lung screening is recommended by the American Lung Association and the American Cancer Society for early detection of lung cancer, the #1 cancer killer of men and women in the world. So, how do you schedule a screening?
Give us a call. My phone number is 304-399-7457, and then I go through that set of questions with them, and once we determine if they're eligible or not, we get it sent off to our scheduling department, and they get you usually scheduled within the week.
Again, the number to call Laura Ferguson, the patient navigator at St. Mary's Regional Lung Center, is 304-399-7457.